So the lung is an important organ. As a respiratory clinician scientist, I am biased, but it really is. In a lifetime, we almost take 1 trillion breaths. And some of us will have already had 3,000 breaths since waking up this morning, and we won't have even noticed. The lung is, of course, continually exposed to irritants, such as air pollution, microbes, such as bacteria and viruses, and of course, toxic exposures from smoke. Whilst many of us don't notice our breath, we may also not notice when a lung problem is becoming evident until it may be too late. Lung diseases are very common, and unfortunately across the world, more than 7 million people die every year as a consequence of a lung problem. The state of the UK lung health is also poor, as has been recognised by government bodies, especially contributing to the winter bed pressures as an example. The KHP translational funding that we've just been awarded will go towards the King's Centre for Lung Health and our vision of eliminating lung diseases through prevention, early diagnosis and treatment. We will be working across our KHP partners from KCL to GSTT and to KCH. With our stakeholders of patients, charitable organisations, clinicians across the healthcare pathways and industry partners, we will be focusing on our 3 themes of risk stratification, early detection and advanced therapy and devices. With the funding, we're very excited about the potential for our 3-year plans. I've highlighted here some potential work that we will do. One is to look at determining the risk of lung diseases by evaluating it in other comorbidities with colleagues across the University of Oxford and the University of Nottingham. Secondly, we will look at diagnosing lung diseases earlier from using AI algorithms for breathing tests with chief investigators here locally at Harefield Hospital. We'll also work with industry partners such as AstraZeneca to look at patient characterizations to target new treatments at acute lung attacks of asthma and COPD or chronic pulmonary obstructive disease. If successful, this will be the first new treatment for lung attacks in over 50 years. And finally, we'll also look at medical devices with partners across the NHS and industry partners to try and see if there are patient characteristics that can improve clinical outcomes with clinical medical devices. We are, of course, very excited about the opportunities this KHP translational funding provides to us, where we hope to improve lung health and equity to all our patients. Thank you.